Thank you. I don't have much in the way of questions because I think these are three very solid pieces of legislation. I appreciate you, Chairman, bringing them before us, and I recognize my friend Mr. Neal's concern. I think that's a legitimate concern, but we're in an unusual circumstances with all due respect to my friends. I don't think they were going to be working with us on this bill no matter what. So arguing for a process when there's no votes in the process, I think somewhat I recognize it. I've been there before myself, but I don't think it really changes the outcome very much. I do want to make a couple of points just in passing, though. You know, in my state, I can tell you what we already have passed is better than what we have. Now, I'm going to ask you, Mr. Brady, is Texas a Medicaid expansion state?
No, sir.
Neither is Oklahoma. And, you know, we have a lot of interesting statistics from the Congressional Budget Office. Some of those people that supposedly are losing health care are in Texas because they're supposed to be on Medicaid expansion, except they're not. But someday they will be. And then so we get to count them as people who lost insurance. I mean, that's the most ridiculous thing ever. I wouldn't speak to the politics of Texas, but I can just tell you in Oklahoma, it's very unlikely that Obamacare as written would ever be accepted by the state. It just will not happen. That's the political reality. We can debate the policy. They're in the middle of a budget crisis themselves right now because of low commodity prices, and they at no point do they think they would be in a position to pay the match, even though this is an exceptionally generous match as originally written by the federal government, and they have very little faith that that 90-10 split would be sustained. They think that it would move toward the mean, which is roughly $2 federal money for every dollar of state, although that varies by states pretty dramatically. So I suspect in Texas as in Oklahoma, because you're not a Medicaid expansion state, and that's a decision you made for state reasons, but your hospitals are caring for a lot of patients that they're not getting compensated for. That's certainly happening in Oklahoma. Under the Republican bill, we'll be better off. We literally, our hospitals will be better off because there will be money for them. We're down, I don't know what it is in Texas, we're down to a single provider in Oklahoma. That provider's been losing money. We think what happened in Iowa, where 94 of 99 counties no longer have coverage, or Tennessee, where I think 16 counties are now losing it, is about to happen to us, or could easily happen to us in the relatively near future. So a tax credit versus nothing you can purchase at all looks better. We'd like to incentivize people. So we think the product, the first product was better. We think it got better in negotiation. We're content to let the Senate continue to work on these issues and see what they come up with. I'm very interested because I frankly have a lot of confidence in people like Senator Alexander, a serious legislator over there, who play a key role. But we'll see. In the meantime, there's no sense waiting around and not moving to make some obvious fixes here. I think that's actually the responsible thing to do. And I want to commend you and your committee for doing that. Again, kind of hard for me to argue against Sam Johnson on anything related to veterans. Hard for me to disagree that we ought to make it easier for people to sustain COBRA coverage when they're caught in those situations. I've been caught in one of those situations in my lifetime. Very grateful that COBRA existed, but it was certainly tough to fund it for a few months. And then verify list, making sure that people that are using benefits that are paid for by American taxpayers are actually eligible to do that seems pretty common sense to me. So I just want to thank you for your good work. I thank you for continuing to try and address this knotty issue, because I can tell you, in my state at least, and I only speak for my state, the current system is not sustainable, will not last. We will find ourselves without coverage pretty quickly, and our hospitals are already hurting in the way that this thing has been structured. So again, standpoint of my state, this is a pretty easy sell. The original Republican bill, the three additions you're making here make it that much more attractive. So that, yield back.
Gentleman yields back. Gentlelady.